Hi, my name is Dr. John Hilinski. I'm a double board certified facial plastic and reconstructive surgeon practicing in San Diego, California. In today's rhinoplasty tutorial, we will be discussing a commonly used procedure termed temporalis or temporal fascia grafting. I would like to start off by clarifying some of the terminology that we will be using throughout this discussion. The temporal fascia refers to a sheet of soft fibrous tissue that forms the outer covering of the muscle that is located over the temple and above the ear. The surgical term grafting refers to any type of tissue taken from one location in the body and used in another. In this particular case, we are taking the temporal fascia and using it in the nose, thus the term temporal fascia grafting. For many years now, I have incorporated temporal fascia grafting as an important part of my rhinoplasty and revision rhinoplasty practice. Let me explain why. One of the well-known risks of undergoing cosmetic rhinoplasty is the possibility that minor contour irregularities may be visible over the bridge and/or tip following whatever surgical changes have been made to the nose. Now, this is a risk that can occur in even the best surgeon's hands, despite the most meticulous technique. The reason this occurs is related to the fact that certain skin types undergo different degrees of change following rhinoplasty. When skin begins to shrink down in size to accommodate what is now a smaller ridge or newly shaped tip, we term this process shrink wrapping, which is similar to what is seen with vacuum packaging of certain items. This is a phenomenon that won't be appreciated immediately or soon after surgery due to soft tissue swelling that helps to cushion the skin. As the healing process continues, however, the swelling subsides and the skin shrink wraps down, potentially revealing unwanted bumps and depressions along the underlying cartilage and bone. One might imagine rhinoplasty patients with thicker skin will be less likely to experience this problem because of the cushioning effect their thick skin provides. In thin skin rhinoplasty patients, however, this shrink wrapping effect can be more problematic. The thinner skin covering these patients will be more susceptible to visible unwanted contour irregularities. This photo example of a patient who underwent prior rhinoplasty by a different plastic surgeon demonstrates what thin skin might do after a period of time. Notice how one can actually trace out the contour of the underlying cartilage and bone because the skin is so thin and has shrunk wrap around the newly shaped nose. In this particular group of rhinoplasty candidates, I would recommend temporal fascia grafting as part of their surgery. By adding this natural, soft tissue cushion under the skin, we can bolster or thicken the skin to minimize chances of visible irregularities. This portion of the procedure is done by making a small incision that is completely hidden within the hair just above the ear. There is no shaving of the hair, and absorbable sutures are used to avoid the need for suture removal. A small piece of fascia is taken off of the muscle which is deep under the skin surface. Normally there are two different layers of fascia that are taken, one termed deep temporal fascia and the other superficial temporal fascia. These two different layers differ in thickness and can be harvested individually to be used for different applications within the same nose. Once cleaned, the fascia is placed under the nasal skin but over the bone and cartilage of the bridge and/or tip. By doing so, we have effectively thickened thin skin to provide a valuable cushion that minimizes chances of contour irregularities. An alternative to using temporal fascia is a material termed alloderm, which comes from cadaveric skin sources or skin taken off of a cadaver. Although considered very safe and effective, alloderm can be quite expensive and is still not as natural as using your own body's tissue. Over the years, I have found that this added step of temporal fascia grafting to be well worth the time and effort in terms of optimizing rhinoplasty and revision rhinoplasty outcomes. I hope this discussion has been informative for you. Thank you.